My name is Cody Sashry. This will be my final project video. I'll be doing an abdominal assessment. So to start out, when I walk in the room, do my hand hygiene, introduce myself to the patient. So hi, my name is Cody. I'll be the nurse taking care of you. I'm just going to do a real quick abdominal assessment. I'll take a minute or two. So the first thing I'll do is I'll uncover the patient's abdomen from the xiphoid process to pubic symphysis. I'll do a thorough inspection, looking for any abnormalities, scars, contour, look at it from different angles, might shine a light to see if I can see the abdominal aorta pulsating. Once I've done my inspection, I'll auscultate. So I'll take my stethoscope, explain to the patient that I'm going to listen in just a few different spots. You usually start in the right lower quadrant over the ileocecal valve, listen to 5 to 10 seconds. Noting the quality of sounds and frequency. I'll move over to the right upper quadrant, then over to the left upper, and then left lower. I'll then switch my stethoscope to the bell side, and I will listen to the abdominal aorta, listen for bruits or any whooshing sounds. So I'll start up the xiphoid process and kind of slowly work my way down to the umbilicus. Once I have done my auscultation, I'll explain to the patient that I'm going to palpate or just kind of gently press on the abdomen. If the patient reports any pain in a specific region, I'll be sure to start on the opposite end. So if the patient's having right lower quadrant abdominal pain, I'll start in the left upper quadrant and just lightly palpate, checking for any masses and tenderness. And once I get down to the area, I'll go back and I'll do a deeper palpation. I'll push a little deeper to feel the major organs in the left upper quadrant, feeling for the spleen, for any enlargement, and the right upper quadrant, any liver enlargement. I'll ask the patient the quality of the pain, and be sure to note if the patient has any pain when I press down, or if the patient has any rebound tenderness, or also check, make note of any guarding that the patient may do. Once I've palpated, I'll percuss. Just over the abdomen, I'll take my 2 fingers and just kind of lightly tap, listening for tympany. Trying to see if there's any difference in sound throughout the abdomen. Then I'll have the patient sit up, and I will check for kidney tenderness. I'll do Kostenberg T-roll check, so on the patient's, the bottom of the patient's rib cage, and just gently tap on both sides, asking the patient if there is any increased pain with tapping. And that concludes my abdominal assessment.